On the neck, three trunks. This is superior trunk, this is medial trunk, and this is inferior. All these trunks is formed by anterior branches of the spinal nerves. We need say from fourth cervical spinal nerve till first thoracic spinal nerve. Anterior branches formed these trunks. Trunks after that continues to the fasciculi, my dear, to the fasciculi. We need to differentiate three fascicles: lateral fascicles, medial, and posterior fascicles. Three fascicles. My dear, we differentiate these fascicles according position around the axillary artery. This is axillary artery. Posterior, take a back side. This lateral fascicle and this medial fascicle. The first, my dear, this white nerve, white, with a big diameter. This is dorsal scapular nerve. It makes innervation for laser and greater rhomboid muscles, and also for levator scapular muscle. After that, my dear, this small nerve, this small, in oblique direction, it passes to the incisura scapulae, and my dear, after that, continues to the back side of our scapula and make innervation for supraspinatus and infraspinatus muscles. After that, my dear, I show for you thoracic longus, this thoracic longus nerve. It comes to the anterior serratus muscle, Due to this muscle, my dear, we can lift our upper limb higher than horizontal plane. Because, my dear, separate deltoid muscle can lift our upper limb only to the horizontal level, higher with anterior serratus muscle. If this, my dear, nerve will be damaged, for example, by knife, so man or woman cannot lift our upper limb higher than horizontal level. This is clinical position. Yes. Because higher only after working the anterior serratus muscle. Only after this. Is it clear? So after this, my dear, please see this nerve. Very interesting. Thoracodorsal nerve. This short branch. Yes. All that I now showed for you, that is short branch of the brachial plexus. It ending, my dear, inside of the latissimus dorsi muscle, this latissimus dorsi muscle. After that, see that, my dear, this one nerve, two nerve, it come in to the greater pectoral muscle. And, my dear, the name of it, medial pectoral nerves. Yes, medial pectoral nerves. This small muscle, like triangle, that is laser pectoral muscle. Inside it, my dear, see that. One nerve, the second nerve, come inside of this muscle. This is the lateral pectoral nerve, also short branches of the brachial plexus. So it makes innervation only for this muscle. Is that clear, my dear? Very nice. After that, this axillary vein, I shift it upward. And, my dear, I show for you very, very interesting two nerves. Very interesting. This, my dear, with a division. Do you see that? Two branches has. This is subscapular nerve. It has division because it makes innervation for two muscles, like subscapular muscles and greater teres muscle. And, my dear, the next, that is axillary nerve, axillary. It passes through the foramen quadrilaterum. with a posterior circumflex gumeri os. Superior wall of the quadrilaterum foramen is subscapular muscle. The medial wall, this is the caput longum of the triceps muscle. The lateral wall, my dear, column chirurgicum of the os ossis humeri, and inferior, my dear, greater teres muscle, greater, not laser. So after this, my dear, we tackled all short branches. So, my dear, I remind for you the area of innervation for axillary nerve. It makes innervation of deltoid muscle. This is, my dear, this deltoid muscle. It makes innervation for it. After that, it makes innervation lateral side of the superior position skin, which covered the deltoid muscle. After that, my dear, the axillary nerve send branch, which has own name, like superior lateral brachial nerve. It makes innervation upper 1/3 of the skin on the lateral side of our brachium. Is it clear? After that, my dear, axillary nerve sends the branch which make innervation for the laser teres muscle. And also axillary nerve make innervation of two articulations, like acromioclavicular articulation, in Latin articulatio acromioclavicularis, and humeri articulation. Articulation humeri, yes. Articulatio humeri. The first long branch, my dear, this is musculocutaneous nerve. That is, my dear, nerve which originates from lateral fasciculus of the brachial plexus. It, my dear, pass through the coracobrachial muscle, make for it innervation, make innervation for biceps brachii, makes for innervation for brachial muscle, this brachial muscle, more deeper than biceps, yes. After that, my dear, it sends to the skin the remaining cutaneae branches. It makes innervation of anterior surface skin of our brachium. After that, my dear, the musculocutaneous nerve make continuation to the forearm. The continuation on the forearm of musculocutaneous nerve has own name. Cutaneous antebrachii lateralis nerve. This my dear, the natural nerve. Cutaneous antebrachii lateralis. It makes innervation of the anterior and lateral side, our skin on forearm. Only this. Without muscles, only skin. After that, my dear, I show for you very interesting nerve. This is this. It originates from medial fascicle, That is cutaneous antebrachii medialis. It passes to the medial side of the forearm and make innervation only skin, anterior and medial surface our skin of forearm. Is it clear? Very nice. The next, my dear, position for us. This is radial nerve. Very, very thick, my dear. This is horror, yes? Very big diameter. Very big. It comes to the humera muscular canal. Canalis humera muscularis. This canal, my dear, has only two walls. Posterior wall, that is triceps brachii. Anterior wall, that is sulcus nervi radialis of the gumeri bone. The structure of gumeri bone. Sulcus nervi radialis. Only two walls has this canal. Yes, my dear. On the, my dear, in region of elbow, it divides into two big branches. In the radial sulcus, my dear, we can see ramus superficialis nervi radialis, superficial branch that of medial border for this sulcus. That is flexor carpi radialis. This flexor carpi radialis. The lateral border for this is brachioradial muscle. Brachioradial muscle. It makes lateral border for radial sulcus. Is it clear? So, my dear, this nerve, superficial branch of the radial nerve, don't innervate muscles. That is skin nerve. Nerve for innervation of the skin. It passes to the back side of our hand, make innervation of radial side of the dorsal surface skin of our hand. After that, my dear, the whole dorsal surface of the thumb, yes. After that, my dear, only dorsal surface of proximal phalanges index finger, the second finger. And, my dear, radial half of the proximal phalange of the third finger. That is all. This is a superficial branch of the radial nerve. It makes innervation only the skin, without muscles. So, my dear, now I show for you deep branch of radial nerve. Deep. It was superficial. Now I show deep. So, my dear, this muscle has own name, extensor digitorum. Extensor digitorum muscle, my dear. Please see that. This nerve. Do you see this white? This is deep branch of the radial nerve. My friends, is it interesting for you? This deep branch make innervation for all muscles of the posterior group of our forearm. All muscles. This is extension muscles, my dear, for extension. It makes extension our hand and our finger. In a case when the radial nerve will damage, the man or woman has the next clinic. Hand, my dear, hand. Without extension. Hand. Not only muscle, my dear, deep branch make innervation. It sends cutaneae, antebrachii, posteriores nerves and make innervation of the posterior side of our skin on the forearm. I show for you, my friends, ulnar nerve. Please, it originates from the medial fascicles of the brachial plexus, from the medial fascicles. It comes to the posterior and medial sulcus of our elbow. And when you damage elbow, you sense a pain in the fifth finger and on the medial part of fourth finger. This is the area of innervation on our hand for ulnar. When you damage our elbow on the medial posterior side. We have a pain in the fifth finger and medial part of the fourth finger. Is it clear? This is our ulnar nerve. This. This nerve don't send branches on the arm. Don't send the branches. But it start make innervation inside of the forearm. For example, for what structures it may make innervation? Maybe this is continuation of the ulnar nerve. This. Ulnar, my dear, sulcus has two border. Laterally make border flexor digitorum superficialis. medially flexor carpi ulnaris. This flexor carpi ulnaris. We have the next clinic. Two fingers in extension. In case when the ulnar nerve damage, the muscles for flexion without tonic. But muscles of extension has tonic, and it make extension and don't allow it make a flexion. Medial nerve. This beautiful thick nerve, medial. It formed by two roots. Lateral root from lateral fascicle and medial root from medial fascicle, yes, by two roots. From two fascicles, my dear, it forms. After that, my dear, it comes into the anterior and medial sulcus of the arm, has projection to the center of our elbow, and after that, my dear, it passes under the muscles. On the my dear, arm, it don't make innervation for nothing. It start make innervation from elbow joint. Yes, it makes innervation elbow joint. After that, it makes innervation for all muscles of the anterior group of our forearm, except flexor carpi ulnaris and medial part of deep flexor digitorum. Deep flexor. Is it clear? Except this, because these muscles receive innervation from ulnar nerve. Another anterior group receive innervation from medial nerve. So, my dear, I show for you on the forearm the medial nerve. This. It has position between flexor digitorum superficialis and flexor digitorum profundus. Yes. It lies between two big muscles. After that, my dear, the medial nerve passes to our hand through canalis carpalis. It passes to the. After that, my dear, it makes innervation 3-whole finger on the palmary surface and lateral half of the fourth finger. It makes also innervation for the first and the second lumbrical muscle, first and the second interosseal muscle, and the muscles of tenor. On the, my dear, dorsal surface, medial nerve makes innervation for medial and distal phalanges of the second and third fingers. But on the fourth finger, it makes innervation only a lateral dorsal part of the medial phalange and lateral and dorsal part of the distal phalange of the fourth finger. That is innervation for medial nerve. My dear, in case when the medial nerve will be damaged, we have, my dear, this clinic. The man or woman cannot make a flexion. Lumbar plexus. So, this is my friends. This obturator nerve, very, very deep, my dear. To obturatory canal passes. Yes? Do you see that or not? Yes. Obturator nerve. I take it by my pincer. It always, my dear, we look for it inside of the small pelvic cavity. Small, not greater. Yes. Laser pelvic cavity. This. Obturator nerve. This is, my dear, genitofemoral nerve. This genitofemoral nerve. This genitofemoralis. This, my dear, cutaneus femoris lateralis nerve. Cutaneus femoris lateralis. This is nervus femoralis. Sic nervus femoralis. This ilioinguinalis nerve. And iliohypogastric, my dear, this higher. It above of our iliac crest. Yes, this. Iliohypogastric nerve. This ilioinguinal nerve. This is lateral femoral cutaneous nerve. This genitofemoral nerve. And at the end, obturator nerve. My dear, there is a question about innervation of the bones. You need say that, for example, bones of our pelvic bone receives innervation from the muscular branches of the lumbar and sacral plexuses. Is it clear, my friends? Through the muscular branches, our bones receives innervation. Rami muscularis in Latin. For example, my dear, rami muscularis make innervation for quadratus lumborum muscle, for iliac muscle, for this muscle like psoas major muscle. This is, my dear, tandem of the psoas minor muscle. These all muscles which I specified for you. These all muscles receive innervation from muscular branches of lumbar plexus. Yes. These branches make innervation not only for muscles and receive and sends your branches to the bone, to the pelvic bone. Is it clear? Very nice. This is iliohypogastric, my dear. Iliohypogastric. It makes innervation for transverse abdominal muscle, external and internal oblique muscle, yes, pyramidal muscle, rectus abdominis muscle. After that, we need to tell about innervation of the skin, my dear. The skin of our pubic region, that is one. The skin of the superior and lateral side of our gluteal region, and the skin above of greater trochanter. Skin above of greater trochanter. So that is for iliohypogastric, my dear, nerve innervation, area of innervation. The second branch, my dear, the second, ilioinguinalis nerve, ilioinguinal nerve. It makes innervation for transverse and external oblique muscle, yes, and make innervation, my dear, of the region of the skin, inguinal region of the skin, yes, inguinal skin of the inguinal region. After that, my dear, in a woman, it makes innervation of the anterior surface of the greater pudendal lips, only anterior surface. On a man, my dear, on a man, it makes innervation the skin of penis, and skin of the anterior surface of scrotal. That is for ilioinguinal nerve. So we continue, my dear, the last fact. Ilioinguinal nerve passes through the inguinal canal, and after that it appears on our genital, on the skin which covered genital organs. The next, my dear, cutaneus femoris lateralis nerve, lateral femoral cutaneous nerve. Yes, my dear. Please remember, it always passes through the muscular lacume. Appear on the lateral side of our femur, yes, of our leg, yes, and it makes innervation for all lateral skin which covered lateral surface of our leg till, my dear, genu joint, lateral surface. it makes innervation, my dear, only for skin, without muscles. The next, my dear, this femoral nerve, femoral. It also, my dear, passes through the muscular lacunae. It divides into three kinds of branches. Cutaneous branches, my dear, make innervation for anterior surface of our skin, of our leg, till genus joint, this. Rami muscularis, my dear, makes innervation for sartorius muscle, for rectus femoris muscle, for, my dear, vastus medianus muscle, for vastus intermedius muscle, for vastus lateralis muscle, and for pectinatus muscle, this pectinatus muscle. This is the area of innervation for muscular branches. And, my dear, the third type of branches, this is saphenous nerve. Saphenous. I show for you it, my dear. Show. This saphenous nerve, this, the longest branch of the femoral nerve is saphenous nerve. My dear, it passes together with femoral artery and femoral vein. My dear, on the upper 1/3 of our leg, it lies inside of the femoral triangle. Now, my dear, I remind for you the bodies of femoral triangle. The medial body is adductor longus. The lateral body is sartorius muscle. The superior body is ligamentum inguinale, inguinal ligament. The bottom of this triangle makes by two muscles. Medial bottom formed by pectinatus muscle, lateral by iliopsoas muscle, by iliopsoas. Pectinatus muscle, my dear, and the iliopsoas, this is the muscles for flexion. Due to this muscle, we can make a flexion on our cox articulation. On our cox articulation. Is it clear? Due to these muscles. Muscles for extension in cox articulation, gluteus maximus muscle. Is it clear, my friend? Very nice. My dear, on the middle 1/3, there is the anterior femoral sulcus. Inside of the sulcus also we can see continuation of the nervus saphenous. This muscle has two bodies. Lateral position for vastus medianus and medial position or medial body. This is adductor longus. After that, my dear, this saphenous nerve come into the canalis adductorius. Come into this canalis adductorius. There is only in this canalis adductorius. There is only in the lower 1/3 on the medial side of our leg. Only in the lower 1/3. It has three walls, my dear. Lateral walls, vastus medianus muscle. Posterior and medial wall, my dear, this is adductor magnus. And anterior wall, that is lamina vastoadductoria. That is connective tissue. That is not muscle. Is it clear? Connective tissue, which has own name, lamina vastoadductoria. Yes. So after that, my dear, on the genu region, this nerve saphenous sends infrapatellar branch. It makes innervation of the medial and anterior surface skin of which cover the genu articulation. On the, my dear, crus region, the saphenous nerve sends branches which has name cutaneae cruris medialis nerves. It makes innervation of anterior and medial surface of the skin of our crus. And after that, my dear, it makes innervation. Foot. But only, my dear, medial part of dorsal surface, our foot, till our first finger, till. The first finger don't receive innervation. Before first finger, it is ending. Through these lacunes passes nerves of the lumbar plexus. For example, did you remember I say for you that through the muscular lacune pass cutaneous femoris lateralis nerve and femoral nerve. Through the vascular lacune passes the femoral branch of the genitofemoral nerve. Is it clear? So, my dear, first of all, I need to say to you that from the spina iliaca anterior superior originates inguinal ligament. It passes to the pubis bone, and by two peduncles it make increasement with the pubis bone. Lateral crus and medial crus, yes. Between two cruces is formed superficial inguinal ring. Superficial inguinal ring. This is the inguinal ligament, yes. Between, my dear, inguinal ligament and eminentia iliopubica, there is arcus iliopectineus. This is a very, very thick structure which formed by connective tissue. This is, my dear, arcus iliopectineus, that is body between muscular lacune and vascular lacune. Is it clear? On the medial side, my dear, between pubis bone and inguinal ligament, there is the ligament which has own name, lacuna ligament, lacuna, like triangle in this place. Lacuna ligament, my dear, this is the medial border for vascular lacune. So now we tackle the walls of the vascular lacune. Medial border, that is ligamentum lacunare. Is it clear? The lateral, that is arcus iliopectineus. Superior and anterior border, inguinal ligament. And, my dear, posterior and inferior border, that is ligamentum pectineale. Pectineal ligament. Is it clear? We tackled the borders for vascular lacune. My dear, I remind you, through the vascular lacune passes femoral branch of the genitofemoral nerve. Is it clear? The next, my dear, is muscular lacune. The medial border for muscular lacune is arcus iliopectineus. Inferior and lateral, this is the pelvic bone. We need to say pelvic bone. And, my dear, superior and anterior, inguinal ligament. Yes. I remind for you, through the muscular lacune pass femoral nerve and cutaneous femoris lateralis nerve. Is it clear, my dear? The next, my dear, this genitofemoral nerve, this is. It divides into the two branches, femoral branch and genital branch. Femoral branch, my dear, pass through the vascular lacune. Is it clear, my dear? It comes to the, my dear, femoral, our leg, and makes innervation only skin above femoral triangle. Above femoral triangle. That is, my dear, one from favorite questions of Vikterovich. He very, very like ask, what nerve makes innervation above of a femoral triangle? That is femoral branch of genitofemoral nerve. Is it clear, my dear? Very nice. The genital branch, my dear, pass through the inguinal canal, genital. It makes innervation for cremaster muscle, for tunica dartos of our testes. Yes, woman without testes. Yes, lateral surface of the skin of scrotal, of men. In women, maybe in women, it makes innervation lateral surface of the greater lip, lateral surface skin of the greater lip, skin. And that is all for it. It's thin, maybe thin, not thick, thin. That is all area innervation. After that, maybe I show for you obturator nerve. This, maybe this. Obturator nerve. This. I take by my pincer. It makes innervation for coxae articulation, for external obturator muscle, and for all, my dear, medial group of muscle of our leg. For example, gracilis muscle, short and long adductor muscle, greater adductor muscle, pectinatus muscle, and external obturator muscle. Is it clear, my dear? It passes through the obturator canal. This, if you, my dear, will look for this nerve on the artificial specimen, it will be this obturator nerve. Is it clear, my dear? This obturator nerve. This obturator canal. Superior wall, my friends, and anterior wall. This is the obturator sulcus of pubic bone. Is it clear for you? And posterior wall, that is obturator membrane and internal obturator muscle. Is it clear, my friend? My dear, for posterior wall, you need say about two elements. In length, my dear, this canal has nearby 2 or 2.5 centimeter. Through this canal pass not only nerve, obturator artery, from 2 till 5 obturator veins, 1 obturator nerve. Is it clear? It passes to our leg from pelvic cavity. This, my dear, inferior obturator nerve, inferior, because it makes an innervation for gluteal maximus muscle. Yes. This is, my friends, pudendal nerves. It go to the anarectal fossa, and sends the perineal branch. It makes innervation for ischio cavernosus muscle, bulbospondylosus muscles, sphincter ani externus, yes, sphincter ani externus, sphincter uretre externus, levator ani muscle, and, my dear, there are two very interesting muscles. Transversus perineae superficialis muscles and transversus perineae profundus muscles. Is it clear, my dear? Deep perineal transverse muscle and superficial perineal transverse muscle. Is it clear? For it also. So, my dear, what are you consider? What will be if this perineal branch was damaged? Loss control of sphincter muscles and sheaths and urine will be passed without our vision. Is it clear? But it is not all. Impotence for men. The penis all will be hand. Yes. No, without erection. Without erections. Yes. Pudendal nerve, yes. Make control about all this perineal yes, region, about perineal region. That is very, very, my dear, dangerous situation, because in this case, man or woman stay invalid, quality of life. stay very, very low, very low. Yes, because there are many functions lost. Yes, and also the problem with the job, with the working for these people. So this is my idea. Another like this branch, like this. This is the muscular branches of the sacral plexus. And this, my dear, very thick nerve. This is ischiadic nerve. The comitans nervi ischiadici, this is artery, which, my dear, make continuation along all lengths of this nerve and make for it blood supply. Is it clear? This is ischiadic nerve. This is, my dear, the long branch of the sacral plexus. After that, my dear, we tackle another branches of sacral plexus. This, my dear, that is anterior sulcus of crus. Anterior sulcus. It has two body. Medial body makes anterior tibial muscle. Lateral body takes extensor digitorum longus muscle. This extensor digitorum longus. So inside of this, inside of the sulcus, we can see deep peroneus nerve. Deep peroneus nerve. Is it clear? This white. It makes innervation for anterior group of muscles of our crus. It makes innervation for short extension for gallucis and another fingers. This short extension has localization on the dorsal surface of our foot. And it makes innervation for skin, my dear, the first space between first and the second fingers, the lateral half of the first finger, and the medial half of the second finger. Is it clear? This is area of innervation for skin, for deep peroneus nerve. In Latin, my dear, peroneus profundus nerve. Nervus peroneus profundus in Latin. Is it clear, my friend? Very nice. So after that, I show for you superficial peroneal nerve. Yes, superficial, this superficial. Nervus peroneus superficialis. It makes innervation for central part of dorsal surface of our skin of the foot. After that, it makes innervation of the medial half of our first finger, lateral part of the second, whole the third, and medial half of the fourth finger, and central part, dorsal surface of our foot. This is the area of innervation, yes, for superficial, on the foot, mainly, on the foot. On the crus, it makes innervation for lateral group of muscles. For example, for long and short peroneus muscles. Is it clear? Also, my dear, it divides into two branches on the dorsal surface of our foot. Cutaneus dorsalis medialis branch and cutaneus dorsalis intermedius. See dorsal surface of the dead body. This is, my dear, ischiadic nerve. Ischiadic nerve. The largest nerve with the biggest diameter in the human organism. The largest nerve. This. It, my dear, has diameter nearby 2 centimeters. This is a middle, my dear, size, not big. My dear, it has localization between laterally biceps femoris muscle, medially semimembranous muscle. This semimembranous between two muscles. Yes, this, my dear, ischiadic nerve. In the, my dear, popliteal fossa, it divisions into two big branches. This is common perineal nerve. not perineal, peroneus nerve. Yes. Peroneus communis, my dear, peroneus communis. This is tibial nerve, tibialis nerve, tibial nerve. So we need to tell about topography of popliteal fossa. So my dear, it has shape like rhomb, So the superior and medial body of this fossa is formed by semimembranous muscle. The superior and lateral body, this is the biceps femoris. The lateral and medial inferior body, this is the caput, my dear, of gastrocnemius muscle. Gastrocnemius. The bottom of this fossa is formed by popliteal surface of femoral bone, and my dear, posterior surface of capsule of genus joint. Is it clear? Always, my dear, always. Lateral position takes nerves inside of this fossa. What I mean nerves? Ischiadic nerve, common peroneus nerve, and tibial nerve. Only take lateral position. The middle position take popliteal vein. This is popliteal vein. And the deepest and medial position, my dear, medial. This intermedial position. The most deep and intermedial, popliteal artery. This is popliteal artery. For this reason, my dear, the operative approach surgery makes through the anterior surface of our genome, not through the posterior, because our artery takes the deepest position inside of the popliteal fossa. Is it clear? Very nice. So, my dear, the tibial nerve has continuation to the canalis crura popliteus, crura popliteal canal. It has, my dear, 4 walls. I remind for you these walls. Anterior wall, posterior tibial muscle. Posterior wall, soleus muscle. Medially, my dear, flexor digitorum longus. And lateral wall, flexor gallucis longus. 4 muscles, my dear, for crura popliteus. Gruber canal. This is the Gruber canal. Gruber's canal. By ossa. Is it clear, man? Very nice. So, my dear, the tibial nerve, now I show for you it, this tibial nerve, makes innervation inside of this canal for all muscles of posterior group of the crus. All posterior group. So, it's in the branch which has own name like cutaneus sure medialis nerve. It makes innervation for posterior and medial surface of the skin of our crus. From the, my dear, common peroneus nerve originates cutaneus sure lateralis nerve. It makes innervation for posterior and lateral surface of our skin of crus. My dear, on 2/3, upper 2/3. After that, my dear, the cutaneus sure lateralis and medialis make inclination and form, my dear, nervus suralis. This is nervus suralis. It is also nerve for skin. Nervus suralis make innervation the skin of our lower 1/3, because upper 1/3 make cutaneus sure lateralis and cutaneus sure medialis. It sends branch to the lateral and dorsal surface of our foot. This branch has own name, my dear, from nervus suralis. Cutaneus dorsalis lateralis. It makes innervation of the skin of the lateral and dorsal surface of our foot, whole dorsal surface of the skin of our fifth, yes, finger, and lateral part of our fourth finger. After that, my dear, we need to tackle the material about plantaris lateralis nerve and plantaris medialis. So, see that, my dear. This is tibial nerve. This tibial nerve. Tibial nerve. It make divisions. Do you see the bifurcation? My friends, do you see the bifurcation? This is a place, my dear, where it divides into two branches. Please, Grijat, Xavier, see that. This tibial, it makes division to the plantaris medialis nerve and plantaris lateralis nerve. So, plantaris medialis nerve pass to the plantaris medialis sulcus and makes innervation for flexor digitorum brevis muscle, for abductor gallucis muscle, and for short flexor of hallucis, and also for first and second lumbrical muscle, And, my dear, the most surface of plantar skin receive innervation from plantary medial nerve, the most, and also 3 with half fingers. For example, the plantar surface skin of the first finger, the second, the third, and medial half of the fourth finger. Yes. The lateral, my dear, plantar nerve, lateral, it makes innervation for abductor digiti minimi. It makes innervation for quadrate muscle of our foot. It makes innervation for muscle which make adduction of gallucis, adductor gallucis, and make innervation for all interosseous muscle and the third and fourth lumbrical muscle. And, my dear, the laser part of our plantar skin receive innervation from lateral plantar nerve. And also, my dear, plantar surface of the fifth finger and lateral surface of the fourth finger. Is it clear, my dear? Now about topography. What body has, for example, medial plantar sulcus? Medially body, this is abductor gallucis muscle, lateral body, flexor digitorum brevis muscle. Sulcus plantaris lateralis. Medially has flexor digitorum brevis muscle, laterally abductor digiti minimi muscle. That is all, my dear, what I need to show for you.